Well, I welcome any advance that they do to benefit the county and benefit the ambulance service themselves. Is it going to make any difference to us in West Clare? We still have an hour to travel and plus to UHL. My concern would be, are the extra ambulances going to add to the bottleneck that's already below in UHL? We've heard and we've seen that where you have ambulances backed up. So now you're adding more ambulances to the fleet. Is that not adding to the problem? That would be my perspective of it.
They would argue then that having more ambulances would enable more people to get the care that they need and would allow them to actually get to the facility. Obviously, you're saying that it could cause problems once they get there, but is it progress that there are more services running at least?
Oh, it's fantastic that there's more services running. But as I said, once you get to UHL, that does not alleviate the problem that is already there. And I think it just concretes the fact that Clare needs its own hospital.
Mm-hmm.
Right? It's something that you can hammer home no matter, and throwing us, to me what they've done is thrown scraps or crumbs and told us it's a cake.
Mm-hmm. So the issue remains, in your view.
The issue still remains UHL. I think what will happen is you're going to add to the bottleneck. They haven't the capacity or the capability of offloading all extra patients down there. We know that. Right?
When you hear about the additional staffing, Deirdre, the new posts being created at Kilrush and Ennis, does it seem that there is maybe more of a focus, still perhaps not enough, but more of a focus on the west and north of the county?
No, I think myself, as I said, it's throwing us scraps and hoping that we'll just go away and be quiet for a while.
Mm-hmm.
I honestly believe that. I think this is their game plan. Just give them something that will satisfy them or will seem to satisfy them. But we're not giving them the full cake. We'll give them the crumbs. And I'm not downgrading the ambulance service by any means. What they do is their work is unbelievable and they're under severe pressure. But what I am saying is it does not alleviate the problem that we do not have a Model 3 or Model 4 hospital in Clare for the people of Clare, for the people of West Clare and North Clare, the whole of Clare.
Mm-hmm.
And you're still going to, if you give an ambulance to every person in West Clare and said, there's your own personal ambulance, it's still not going to alleviate the bottleneck that we know is UHL.
Mm-hmm.
And if you have 6 extra ambulances below in Kilrush and another 6 or 7 above in Ennis, that's 13 ambulances arriving down with 13 extra patients into what we already know is a war zone. How many more trolleys? Is that 13 extra trolleys? 13 extra people on trolleys?
Mm-hmm. So it's not getting to the root of the problem.
People have waited for ambulances. I waited myself with my mother for 2 hours, and she was a stroke victim. But it still is not helping the issue that is at hand. All it's doing is camouflaging.
Okay. This news was, of course, given by the National Ambulance Service at a meeting of the Midwest TDs and Senators organised by Deputy Joe Cooney of Fine Gael. And speaking on this announcement, when asked about the upcoming visit of the Health Minister, who, as you know, has accepted an invitation and is coming to this county in the near future, Joe Cooney was asked by Clare FM if he will be during that visit pushing for a new A&D and a new emergency department in County Clare, and his response was that he will be pushing for better health services for the people of County Clare, whether those services be in Clare or in Limerick. Does that response concern you in any way?
Yes, it does, because Joe Cooney is now towing Fine Gael's party line. He's doing what he's told. He's not doing what he was elected for.
Of course, Deputy Cooney would say that he is pushing for better health services for the people of County Clare, and even when you consider that this announcement from the National Ambulance Service came out of a meeting organised by Deputy Cooney, he would of course make the argument that he is fighting for better healthcare in the Midwest.
I don't think so. This is something the ambulance service have been fighting for a long, long time, ever before Joe Cooney was elected. So I wouldn't put this and give him the praise for something the ambulance service themselves have been fighting for. I really wouldn't. The workers there have been, under severe amount of pressure for years. It's not, this didn't just happen yesterday or the day before since Joe Cooney was elected. This has been going on for a long, long time.
Okay.
And I think myself, they've just seen an opportunity to give them. They also have to know that the pressure is real. It's not something that these drivers or staff of the ambulance service make up. They're on the road every day, every hour of every day. They know what they're facing. They know exactly the conditions they're facing as well. But they have everything they have been saying for the last number of years has been falling on deaf ears.